Are you considering using L-Citrulline to assist with erectile function? Hi guys, I'm Dr. Kidd, a board-certified family medicine physician who's helped hundreds of patients with erectile dysfunction. And in this video, I'm going to give you all the key information you need to know about L-Citrulline. I'm going to compare it to the efficacy of typical treatments such as Viagra and Cialis. And I'm also going to give you my bottom line recommendation of whether you should use L-Citrulline to assist with erectile dysfunction. So how does L-Citrulline help with erections? L-Citrulline is an amino acid that when taken is converted to L-arginine in the kidney. And then this is converted to nitric oxide, which is a key chemical that helps us initiate and sustain erections. The way that nitric oxide works is that it dilates blood vessels of the penis, known as arteries, which then increases blood flow to the penis, which then results in an erection. So there's a plausible mechanism of how L-Citrulline may improve erections, but doesn't actually provide any benefit. At the time of recording this video, there was only one small study that investigated the effect of L-Citrulline in the management of erectile dysfunction. This study enrolled 24 men with mild erectile dysfunction, defined as an erection hardness score of 3. The erection hardness score is a simple scale that grades how hard an erection is from a scale of 1 to 4. A score of 1 is no erection, a score of 2 is that it's hard but not hard enough for penetration, a score of 3 is hard enough for penetration but not completely hard, a score of 4 is completely hard and fully rigid. Each of the 24 men received a placebo, which is a pill with no active treatment, and they had this for 1 month, and then they were switched over to L-Citrulline 1.5 grams a day for another month. What they found was that 2 out of the 24 men improved on an erection hardness score from 3 to 4 when they were taking the placebo for the first month, and 12 out of 24 men improved on an erection hardness score from 3 to 4 when they were taking the 1.5 grams L-Citrulline for the second month. So that sounds pretty good, right? Should we recommend all men with erectile dysfunction try L-Citrulline? Well, there are a couple of weaknesses with the data of this study. The first is that the sample size was very small with only 24 patients. Larger sample sizes are needed to give us more confidence in our results and that observed findings did not happen simply by chance. The second weakness of this study was that it was a single blinded study. This means that the participants did not know when they were taking the placebo or the active treatment, which is good at reducing bias, but the researchers did know. This can introduce bias into the results, as the researchers may subconsciously be influenced in the way they interact with participants and also how they collect and record the data. Lastly, the only participants included in this study were those with mild erectile dysfunction, defined as an erection hardness score of 3, so all already had an erection hard enough for penetration. This means you may not be able to extrapolate the results to patients with more severe erectile dysfunction. So how do these results compare to Viagra and Cialis? The results of the above studies suggest that 50% of patients that take L-Citrulline have an improvement in their erectile dysfunction. Studies of Viagra, otherwise known as sildenafil, and Cialis, otherwise known as tadalafil, often get better results in the 60 to 80% range of improvement in patients taking this pill with erectile dysfunction. In addition, these studies have larger sample sizes and they're often double-blinded, giving us more confidence in the results. Interestingly, placebo also tends to get quite good results as well in erectile dysfunction studies. Typically, 20 to 40% of patients have an improvement in erectile dysfunction when given placebo, despite not having any active treatment. Therefore, the only 8% improvement in erectile dysfunction with placebo in this study is far lower than what is typically observed in most erectile dysfunction studies. If we compare L-Citrulline's effect to what is typically seen with placebo, there is only a marginal improvement over placebo from 20 to 40% of placebo to 50% with L-Citrulline. On top of this, it was only a single blinded study with a low sample size, so our confidence of the results are already low. Therefore, larger double-blinded studies are needed to know whether L-Citrulline actually gives any additional benefit over just placebo. So what's the bottom line? Should you take it? Well, if you have erectile dysfunction, the best advice I can give is to make sure you see your doctor to get a personalized assessment and management plan. But if I speak in generalized terms, the most common causes of erectile dysfunction are psychogenic and vascular. This means that high yield results usually come firstly from changing lifestyle factors, which means ensuring that you have a very healthy diet, exercise regularly, don't smoke, don't drink, and making sure that you're managing stress effectively. If all of these factors are optimized and there's no clear underlying cause from tests of your erectile dysfunction, then the next step might be to try a medication or a supplement. In most cases, my recommendation for higher yield is actually tried and tested treatments, such as sildenafil, which is known as Viagra, or tadalafil, otherwise known as Cialis. These have shown to have very good results with very minimal side effects. However, if you do try these medications and you have bad side effects, or you just have a personal preference to not want to take these medications, then consideration of L-Citrulline is not unreasonable. So that's my summary of L-Citrulline and erectile dysfunction. If you found this video helpful, don't forget to like and subscribe to the channel. If you want to learn about another supplement that can help erectile dysfunction that has a bit more research behind it, check out the video here on folic acid, and I'll see you in the next video.